Hello everyone, today's presentation topic would be on ADHD medication as a study aid for college students. I am Sally Pei and I'm from the School of Biosciences, Taylor's University, Malaysia. This is a picture of Taylor's University Lakeside campus in Malaysia. I chose this topic for my research and my presentation because as a student myself, I find it highly relevant. Besides that, I'm highly interested in the mechanisms of ADHD medication as a study aid and also in the ethical issues involved in ingesting performance-enhancing drugs. And all these issues will be covered in my presentations in later slides. I am sure many students can relate to the lady in the picture. The frustration, the late nights, being under pressure before an exam. Some of us may even find it hard to focus or try not to be distracted. A survey has been conducted and it has been found that a vast majority of 40% of students choose to use ADHD medication to increase their focus and to be more attentive to their work. Another 22% try to be more wakeful with the drugs, while the others would like to better perform during exams and clinical duties with 18% and 15% respectively. Do take note that all of these are non-medical reasons to use ADHD medication. But before we go too far, let me just briefly explain what ADHD is. Attention Deficit Hyperactivity Disorder, or ADHD, is a condition marked by persistent inattention, hyperactivity, impulsivity, and distractedness. People with ADHD has a short attention span and is seen moving about not being able to settle down. So what is the general classification of ADHD medication? They are stimulants or psychostimulants. These are used to improve concentration and impulse control in ADHD. These are the two common psychostimulants used in ADHD, Adderall and Ritalin, and Adderall is the more preferred or common over Ritalin. So how do they work? It's a very simple concept. Psychostimulants stimulate the release of neurotransmitters dopamine and norepinephrine. Dopamine and norepinephrine have their specific roles, dopamine playing a role in memory formation and addictive behaviors, which can be a side effect. Norepinephrine playing a role in arousal and attentiveness. The increase in neurotransmitters dopamine and norepinephrine naturally increase or boost attention, helps learning by enhancing focus, and they also helps impulse controlling in people with ADHD. This picture shows us that the differences between the brain with Adderall is very distinct from the brain without Adderall, red color being the indicator for activity. It can be concluded that ingesting Adderall increases the activity of the central nervous system, that being the brain, and it also enhances focus and attentiveness. Besides that, it has been proven that the increase in neurotransmitter dopamine levels can also help decrease stress. This means that students can study for an extended period of time without being distracted and at the same time remain calm, preventing panic attacks from before exams. In this graph on the left, the red color is an indicator of full-time college students aged between 18 to 22 years old, while the blue represents their peers of a similar age range. It can be seen that full-time college students were twice, if not more likely, to abuse Adderall than their peers who are not in college. The next graph shows a persistent increase in sales of ADHD drugs in terms of prescription in millions and sales in billions. One can argue that the increase in sales are merely an indicator of the increasing population. However, do take note that ADHD drugs that are used for non-medical purposes are usually obtained through illegal means. It could be obtained from family, friends, and especially peers over the counter. And so these purchases are very hard to track. However, there have been surveys that have been done in the past, and to this very day, it is clear that this trend remains popular among college students. And all of this has to stop. From 2004 to 2012 alone, there are 17,021 adverse drug reactions related to ADHD medication that have been reported, and it can be safe to conclude that there are three main side effects, being the possibility of death, psychiatric problems, and severe addiction. The possibility of death can have two causes, one being higher cardiac risk and the other increased toxicity. We have to take note that non-medical usage of ADHD medication is illegal, and hence drugs are usually obtained without prescription and medical review. This often than not leads to drug overdose because students do not possess the knowledge of the correct dosage. And so the higher the dosage, the higher the heart rate and blood pressure. And this would inadvertently result in a higher cardiac risk. Over the years, there have been cases of heart attacks and strokes that have been connected to ADHD medication. For increased toxicity, again, non-medical usage of ADHD medication is illegal, hence drugs are obtained without professional advice. Students tend to take counteractive drugs to reduce stimulant effects when they no longer require to focus for an extended period of time, and the combination of drugs would lead to increased toxicity, and this in turn may result in death. Psychiatric problems result from both physical and psychological dependence. Physical dependence refers to students who rely on drugs for normal bodily or physiological function. The rise in chemicals in the brain would eventually lead to dependency, and once the drugs are taken away or reduced in amount, withdrawal symptoms will occur, and examples are fatigue, depression, problem sleeping, among many other side effects. For psychological dependence, this usually refers to drugs that are taken as part of a pattern or a habit, and any disruption in this pattern can cause other side effects like hostility, insecurity, aggression, and anxiety. And last but not least, addiction, because amphetamines in ADHD drugs have the highest potential for severe psychological dependence and abuse. Once addicted, students will develop a higher tolerance towards drugs. This means that they will have to require a higher dosage as compared to before, and the increase in dosage would in turn lead to all the side effects that have been previously mentioned. This includes increase in cardiac risk, the increase in toxicity, and also all the side effects combined from physical and psychological dependence. This pie chart shows the top 10 adverse reactions that have been obtained from the CCHR International 2014. Do take note that overdosage and higher tolerance that result in ineffective drugs are both in the top 10. The rest are made up of mainly psychological side effects. Now we come to the ethical issues involved. I'm sure that all of us would agree that it would be highly unfair to compare between students who are taking the drugs and students who are not, especially when it is not obvious when they do so. Leaving this trend unchecked between students would encourage others to follow, because the ones who are not taking the drugs would do so in order to not be left behind in terms of scholastic performance. It must be stressed, however, that taking the drugs does not in any way showcase your ability or skills. And if left unchecked by parents, the government, teachers, families, and friends, the integrity of education would be sure to crumble. In conclusion, ADHD medication as a performance-enhancing drug remains popular with college students, and this should be stopped due to health and psychological risks, and that ADHD medication should at all times be taken with prescription and professional medical advice. This is to avoid all health and psychological complications. Intelligence and skill should not be measured through unfair comparison, and the takeaway message from my presentation would be that ADHD medication should not in any case be used as a study aid. And so that's the end of it. Thank you for your time in reviewing my presentation, and have a nice day.